COVID, a tough time for all of us. Whether you believe the media, question the media, or have a personal story of your own, this has affected us all. Welcome to the COVID in the Community podcast, brought to you by the Greater Washington Urban League. I'm your host, Xavier Snow. We use this platform to connect with our community and share stories in the hopes of raising awareness and building confidence in our fellow neighbor. It has been said that we are all in this together. However, there are those talking and those listening. My aim here is to make sure all who listen use their best judgment moving forward on this trajectory. It's hard to add flair to such a dire topic, but I assure you, passion and purpose are my main driving forces. Let's get informed in a comfortable way. Today, I am joined by a very spectacular human being and doctor in training. I am beyond blessed to be here with such an ambitious young man. It is with great pride and gratitude that I get to sit down and have this conversation with Mr. Avery Huggins. First off, thank you for agreeing to talk to us today. Now, sir, can you please tell the people more about who you are and what it is that you do?
Thanks for having me. I don't know if I can live up to that introduction. Very spectacular. Wow. But yeah, thanks. No, what do I do? So I'm a registered nurse. I work in the emergency department. That's my primary specialty, both adults and pediatrics. Um, and what else? I work some other specialties as well, but registered nurse in the ER. I'm working on a doctorate in nursing practice. So that's the doctorate training. That's where that comes in. But that's me.
And how did you get started in the field of saving lives? What inspired you?
So my mother is a registered nurse. She's been a nurse for over 30 years, and I initially had plans to go into maybe dentistry. I know that I wanted to work in healthcare, but I just wasn't sure exactly where, and I kind of for dental school, but my mom, being a nurse, was just encouraging me that nursing was like a better 4 year degree,
Hmm.
and that I would have just a lot more options and flexibility there. So after some convincing, I kind of switched over, changed my major, and yeah, then I was kind of sold once I got into it, the nursing program, and started learning more about the different specialties and different some of the different career paths that I can take with nursing. I fell in love, I guess you could say.
Wow, yeah, man, it's a blessing. It always seems like mother knows best, right?
Yeah, Mom always knows best.
That's word, man. That's word. So, one of the things that we spoke about briefly was the fact that you actually went to your home state of New York at the onset of this pandemic when things were very, very hectic, kind of like how it is now. I believe there were even some reports of hospital shortages and just not enough beds. Some people were calling it a hoax, false news, etc. But if you could, from a firsthand perspective, could you kind of talk about the realities of the situation from your personal point of view?
Yeah, sure. New York was going out there was very special to me just because that's where I was born and raised, and just it was a great privilege just to go out there and support and help out some of the hospitals that had the nursing shortages and just needed some support during that time of the outbreak. It's kind of unfortunate to hear people say that this is a hoax, and the media and is just kind of portraying all these fake statistics or fake news. Just because while I was there, it was very difficult, a very hard time for us as healthcare professionals, but it was also a very time for a lot of the families that were affected. Um, so it's like on one hand, you hear people saying that it's not real and fake news, it's a hoax, but then on the other hand, you have people are um, who are unable to kind of even be with their loved ones during their dying breaths, during some
Mm,
of their last minutes of life. So it
right.
was very difficult. It was a very difficult time. Um, for all of us for the state of New York kind of being like the first one of the epicenters there, especially like in Queens, New York, it was really bad as well. um But yeah, it was just a difficult time all around. Considering just yeah what was going on. So yeah, New York was it was hard, but it was I was very just grateful, and I considered it just like a great privilege and an honor just to be able to help out the some of the communities I grew up in.
Absolutely, absolutely, man. Yeah, that's real. I think more people now are obviously, being more cautious and taking those precautions. But for those that may still feel as though, for whatever reason, it's not real,
Hmm.
because there are people like that.
Yeah.
Um, what do you have any words that you would like to just share with those people right now?
Oh man. I mean it's tough because it's almost like one of those things that you kind of just have to if you still at this point where we are in the pandemic, if you still believe that there's some hoax going on, I think I think it's just a certain level of ignorance now because then you have to explain why is it that like the deaths, I think, or the hospitalizations, the ICU admissions and different things like that. There has to be you have to give us some sort of rationale for what's going on. So I don't know if I would even address the disbelief, but
Mm-hmm.
just to say that like the current statistics and the facts and the deaths are very real. So if you don't want to believe it, that's on you. But regardless of what your thoughts are, what you believe, like there's people who are being diagnosed with COVID and people whose causes of death are probably complications to the coronavirus. So those things are very real there.
Absolutely, absolutely. I appreciate that.
Yeah.
One of the things that is very interesting about this virus that I actually spoke with epidemiologist Dr. Lisa Fitzpatrick on our WPGC interview, with just the fact that since it was a novel or a new virus, it seems like there's always something to be learned about it.
Hmm.
Every time we were told something about the virus, it seems like things switch, whether that be the protocols, how we prepare for it, how we went about just being safe in general.
Hmm. Hmm.
So, how does the everyday person go about discerning accurate information at this time? What are some of the factors to pay attention to?
Right, right. And you're absolutely right. I think in the beginning, I agree with that 100%. There were, and even for us as healthcare workers in the hospital, it was changing for us as well. So, there are days where they're telling us this is the amount of PPE that we need. We only need the mask.
Mm-hmm.
And then there are days where like, all right, now we believe it might be airborne, and then they say, okay, now we're just gonna wear a full gown. I think where we are now in terms of just like healthcare workers, they're just taking the just all precautions, just because we're learning as we go. So
Mm-hmm.
just to protect us as much as possible, we're just covering up and trying to prevent the spread of everything as much as we can, limit just contact with one another. And just advice, I guess, for the public on ways to just discern what's real from what's not real.
Mm-hmm.
I would just say I know it's difficult now just because of leadership,
Right.
like leadership in our government and how they just kind of haven't proven to be the most trustworthy. It's very difficult because of that. I do think if there was like if we were in a different time, maybe with just some different leadership, it would be easier to trust the public, or like trust some of the information. But it's very hard to trust what's going on when you have one person or people who are in authority telling you that the health officials that we trust shouldn't necessarily be trusted.
Mm-hmm.
So it's very difficult. I would say just kind of continue to do what has proved that what has worked, and that's wearing the mask, and just kind of limiting just the large groups and any types of events where people are not wearing masks and things like that. Those have kind of shown us to be the most effective during this time. And then moving forward with anything else is just kind of waiting for all the information. Maybe not just jumping on things as soon as they come, but just kind of giving it some time to more people, more trusted health officials to co-sign and get behind some of the statements.
Now, as it relates to the vaccines and the future release,
Mm.
what should people be looking for, and how should we go about just being prepared on when we should really trust it, what's going on?
Yeah, so the vaccines, it kind of goes into what was previously stated. Um, leadership just made it very hard for us to trust them. So I do think, just for the general public, I would say wait again, just kind of waiting for more information to come in, waiting for more people to kind of co-sign and get behind the vaccine. From what I understand, it's going to go out to the military first, and then maybe some healthcare workers, some frontline. Or essential workers and things like that. But just kind of allowing all the research and all like the experts, the health officials and experts to kind of weigh in on it. And even waiting for like the military. I know that's kind of hard to say, but even waiting for maybe some of those first recipients to kind of go through it and just kind of see how they do before we kind of all jump on it. But for right now, what's most important is just to continue to do what we've been doing.
Now, let's just jump back real quick to the beginning of the pandemic, or at
Mhm.
least when it was, at the height. Back in April, and you were going in April when you were going to New York and helping these hospitals. One of the things that you mentioned on our call was that there wasn't enough coverage, or at least I don't believe so. There's not enough coverage for the fact that doctors that have contracted COVID-19, they've actually passed on because of this pandemic. From a healthcare worker's perspective, what would you want most people to know about your profession that maybe they wouldn't have known previously?
Oh man, that's a good one. I think what's most important is, or what I would like personally for everyone to understand about healthcare workers is that we're not trying to get over on you. Like there's no benefit for us. Like we're not trying to pull a fast one. Like we're not trying to hurt you in any way. So when we are in the hospitals, when you come to us for help or for any care, we all signed up to do the best that we can to help you feel better or to prevent you from getting hurt or sick or anything like that. So keeping those things in mind, I think, as a patient or just as someone seeking information or any type of care or help, I think that kind of goes a long way because then it kind of sets your mindset up for your actions and your decisions moving forward, knowing that these
Mm,
individuals are not here to hurt me, or to kind of just spread false information that they've been given. That kind of sets the tone for just like a good relationship, and it also sets the tone just for better care. I think when
mm.
both parties kind of come in with the right mindset, expectations and perspective, I think it can go a long way.
Absolutely, absolutely, and I think that's especially important. When you see the studies about black people who have not been treated properly, or at least have not been,
Right.
heard, and
Hmm.
we're
Hmm.
not given the pain medicines that we need.
Right.
Those all tie hand in hand with the expectations and the trust factor. So
Hmm.
I think that's really good suggestions.
Yep.
Now, as we mentioned earlier in this program, one of the things that the Washington Urban League is a part of is the contact tracing awareness.
Right.
One of the challenges countrywide we are seeing with the contact tracing is the speed at which people who have tested positive are being contacted.
Hmm.
Can you please discuss why it is so important to reach out to these people and their contacts as soon as possible?
Why is it important? Well, mostly because I think once again, we are learning as we go when it comes to COVID-19. And what I've seen in the hospitals are you'll have some people who come in with no symptoms, who come in looking very okay physically, or just passing the eye test, like this person is fine. And then they'll do a COVID, they'll get tested and they'll test positive, and then you'll have someone who looks very sick, and then they're going through it, and they might be kind of going through it so much that they need to be admitted to the hospital. It can be so bad that they might need a breathing tube, and they might be intubated and even admitted to the ICU or transferred to the ICU. So understanding that the two, I guess, extremes of this, this is why it's very important to contact individuals about the possible exposure, just so that, because we don't know, we don't pick and choose who how your body responds to it, or what symptoms you experience, or just how you manifest, or how COVID-19 manifests in each individual. It's not us that's doing it.
Mm,
So because we have no control over that, I think that's what makes it extra important for everyone to take the proper precautions, and for those who are helping out with tracing, to contact people right away, because you know you may be okay with it and be asymptomatic or have very mild symptoms, but the person that you potentially exposed to it can easily be an ICU admission, and possibly even lead to death. So that's why, like, it's very important to be vigilant about this.
absolutely. And I'm really curious, because we're hearing that, because I think a lot of people, they just assume, all right, well, I'm not dying, well, or at least the chances of me dying if I contract this disease are not so high,
Right.
right? But what are the things that I feel like a lot of people may not be aware of is the long-lasting impacts of COVID-19,
Right.
even after you recover. Can you kind of shed some light on some of the things that may happen after you contract COVID and come back to normal health?
Yeah, sure. So, I mean, this is a another kind of open ended conversation, where it's like, we don't know a lot. We're not. Yeah, there's not enough research. There's not enough time, honestly, that has gone by, so we can do enough of a study to really say, like, these are some of the consequences, and draw some of those connections. I know some from, since I guess the beginning of, like, the pandemic in New York. I know that there's been things, reports of people saying that they've lost their their sense of smell. They like their taste buds, they can't really taste food anymore. Those are some of the most common ones that I have heard, and
Right.
this is months after where they have been COVID free, and they still have no type of sensation at all. So that has been some of the more common ones. One thing that we saw early in the pandemic as well was that COVID, well, we'll get people who tested positive for COVID, and then they will also test positive for, like, blood clots. So it was causing
Right.
clots, whether it be in the leg, in the lungs. So that was another thing that we saw as well. So something that started off as some primarily respiratory illness became something now where doctors are doing this full inflammatory workup process to see if they're checking your clotting factors, they're checking some of your inflammatory markers. So there's just a lot of, like, it's become a very extensive workup now, whereas it was being treated as a respiratory kind of illness.
Got it. Got it. Yeah. So it's levels to this COVID.
There's many levels, and we really don't know. Like, there may be studies in the future that says, COVID has caused this, or some of you might experience this, but it's just not enough time has passed, not enough research has been done. We haven't studied enough, but more time will tell when it comes to, like, some of the lasting effects of COVID. It's too soon to really conclude on what those are now.
Absolutely. So without a doubt, COVID-19 has wreaked havoc on America, even across the globe. The black community was not spared by any means.
Oh, no.
However, I was taught to always look for the silver lining in every situation.
Right.
In your opinion, what are some of the positives that have come from this pandemic, and how can we use those to springboard us into a more optimistic future?
Hmm. Oh, man. I think this is a tricky question to
Mm,
answer, because I want to have respect or be reverent for so many of the lives that were lost during this time.
right.
Um, so I know a lot of people have been kind of saying, like, the pandemic or COVID. it was the best thing that ever happened to me. And it might be for some people, but for some others, it's taking away parents. It's taking away siblings and children and just all these loved ones. So this is a tricky question for me, but I do think some of the apart from the lives lost, I think that the quarantining and the social distancing and just it kind of forced us to spend more time at home and more time with ourselves, getting to know us more. There's been less, I guess, distractions and entertainment things that would take away from time in the house. So I think it's forced us to be more creative,
Mm-hmm.
forced us to really reevaluate some of our relationships, whether it be with family members or loved ones, to really um, try to just figure out what's most important to us, just kind of placing a stronger value on things. And I hope that, it kind of gave us more time to spend, with the family and with ourselves as well, mostly just getting to know ourselves more, getting to kind of love ourselves more and love those close to us. And I think it also allowed us to value time a little differently and make the most of the time that we do have now, just because something like this, I know many of us and have never even thought that something like this could happen um, to a country like the United States or just to us in general. So I think that COVID-19 definitely put a lot of things into perspective for us and kind of changed us. I'm hoping for the best as a people.
Absolutely, man. Absolutely. Yeah, that's what we're praying for, man. We just gotta keep positive, keep that energy up,
Right.
you know, stay focused on the things that matter, like our family.
Yep. Yep.
Speaking of which, we're obviously a couple days from Thanksgiving,
Yeah.
with Christmas right around the corner.
Right.
Um, as we come into the home stretch of the holiday season, we're also met with the flu season.
Mm.
What advice would you give people that have maybe not seen their families this year, and are looking to go and travel during the holiday times? What would you suggest that they do despite all the risks posed in the family gatherings?
Oh man, that's so tough because I want to see family. Everybody wants to see
Right,
their
right.
family, especially during this time. I think one thing that I'm seeing is that people are just kind of being as responsible as they can and taking initiative. So, COVID testing. It's hard to tell people not to go to see family or not to gather, but what it looks like people are doing are kind of getting some tests, maybe preparing themselves now, like if they are going out and being around a lot of people. If they have plans to travel and be with family members, they're beginning the quarantining now, maybe 2 weeks out, limiting their interaction so that they can kind of be a little bit more sure that they're not exposing themselves to anyone, and then they're also not gonna expose their family members as well. So they're getting their COVID test. They're trying to quarantine before their visits with family. I'm hoping that we keep this very small and don't overdo it. If you do want to extend it to the more than your immediate family, I think what some places and states are saying is like no more than 10.
Okay.
So I think if we kind of just respect those and pay attention to those, I think that's what's most important. Yeah, and it's just being responsible. I did see something online somewhere that said a Zoom's giving is better than an ICU Christmas. Uh,
Mm,
so that's something that kind of would be a little
I love
provocative,
that.
and it's going to resonate with some people. So it's just kind of putting some things into perspective. We really don't know the we don't know that much about this virus, and like I said earlier, it affects everyone and interacts and manifests in each of us differently. So just be responsible and be as safe as you can. So yeah, that's my advice to everyone. If you're gonna do it and gather, you know, make it a small one and try as much as you can to limit your exposure with others before you travel to your family members and make sure that they're doing the same as well, so that we're not spreading this virus.
Absolutely, absolutely. Now, one more thing I want to touch on before I let you go. I know that you have been very busy with the whole COVID-19 pandemic and just traveling and just being very active in the whole fight against this virus. Um, what are some of your takeaways from all of the travels that you've gone through? What are some of the differences that you've seen in your experiences as it relates to COVID-19?
Hmm. Some of the differences, takeaways. A lot of it has just been, I think me personally, man, just kind of being a little bit more grateful, and just trying to make the most of our time here. Just looking at how things can kind of just change so quickly. You know, there's from coworkers that I've worked with to them coming down with the virus, and just being so close to so much of it and so much of the deaths, and just seeing what it's been doing. It's just putting me in a place of just tremendous gratitude, and it's a very humbling experience, just for me, during just, yeah, just seeing from going to New York to Florida to now being back here in DC.
Hmm.
A lot has gone on over the last couple months here, and it's been a hard year for a lot of people. So we just need so much healing. So I'm just
Yeah.
in a place of complete. I'm humbled, and I really want us to kind of get through this pandemic, and I want everyone to be safe, and just kind of be responsible for yourself, and participate in the protection of others. Just don't be selfish and say that, you might not be getting it, or you've been okay, and just don't be reckless about your behavior. Think about the others and how it might impact or affect them. So that's my takeaway. Is just, I hope that I'm trying to be more conscious every day, and I'm hoping that other people can do the same, because this is not something that is singular. It's definitely something that affects everybody around us. So we all have a part to play in the prevention and getting past this pandemic, getting out of this pandemic, and getting over COVID-19. We all have a part to play.
Yes, sir. Yes, sir. And I just want to say thank you sincerely for taking the time from your busy schedule to speak with us about COVID-19 in the community. Are there any final remarks? I know you said a lot of profound statements, a lot of profound statements were said, but is there any final remarks that you just want to leave the people before we sign out?
Any final remarks? I think just let's try to spread some more love, and that doesn't mean go and touch people and gather in groups, but just love on the people in your families, your close ones, your loved ones, your friends. Just spread it as much as you can, just because if there's one thing that COVID has taught us, or shown us at least, is just that it reminds us of how fragile life is. And I think that let's not leave anything unsaid this year or the years to come. Like,
Hmm.
express yourself to those around you, and just make the most of life, and love, live, laugh. Just enjoy it while you can, guys. That's what. And I'm saying this not just to older people. I'm saying it to
Hmm.
young, to old, and everybody in between. Like, COVID-19 definitely did not discriminate, or doesn't discriminate, no matter what your age is, your race. So while you have the opportunity, make the most of
Right on, brother. Right on,
it.
man. Now, last question: where can people contact you if they have some questions on COVID-19 or they just want to check you out
Sure.
online?
You guys can email me at Ave Huggins, AveHuggins @gmail.com. And then I'm on LinkedIn as well at, I think my name just Avery, and then my first two initials of my last name. So Avery and HU on LinkedIn. So you guys can definitely send me a message there, and we can talk some more about it. And anything is fine too. It doesn't have to be COVID, anything healthcare, anything. That's fine.
We dealt with some amazing topics today. Thank you for staying with us. Stay connected with us directly through gwul.org/CCTAP. You can also join the discussion on Twitter at GW Urban League and Instagram at GWUL365. If you would like to speak with us directly, please send us an email through gwulinfo@gwul.org. And as always, thank you for allowing understanding while dealing with all different opinions. This concludes the COVID in the Community podcast. Don't forget to like, subscribe, and visit coronavirus.dc.gov for all the up-to-date statistics on COVID-19 in DC. Until next time, remember to wear a mask, social distance, and always wash your hands.